In Uganda, many women face severe health risks during and after childbirth, yet few are fully aware of the dangers. Among the most life-threatening complications are postpartum hemorrhage and preeclampsia, conditions that are both common and largely preventable with timely medical intervention. According to the Ministry of Health, Uganda's maternal mortality ratio has reduced from 336 deaths per 100,000 live births in 2016 to an estimated 189 by 2023. However, postpartum hemorrhage (PPH) alone accounts for about 27 to 34% of maternal deaths, while hypertensive disorders like preeclampsia contribute to 6 to 15% of maternal deaths in referral hospitals such as Mulago. Postpartum hemorrhage, which refers to excessive bleeding after childbirth, is a major contributor to maternal deaths in Uganda. A 2013 to 14 study in 6 rural health facilities found that 9% of mothers experience PPH, with 1.2% suffering severe hemorrhage. Facilities in districts like Impigi and Butambala showed limited readiness for postpartum care, scoring just 24% in facility preparedness, highlighting weak monitoring, drug stockouts, and untrained staff. Dr. Barugaba Umar, a physician at CareMax Clinic, explained, "From my experience, the biggest cause of postpartum hemorrhage is a uterus that fails to contract after birth, medically termed as uterine atony, and it leads to dangerous bleeding. Sometimes it's made worse by delays in referral or lack of blood at the facility." In Mbarara district, hospital data shows that PPH cases make up nearly 1/3 of all maternal emergencies, above the national average. The region has also seen a rise in complications linked to traditional birth attendants who may lack knowledge of safe delivery practices. Preeclampsia, another deadly complication characterized by high blood pressure and organ dysfunction during pregnancy. A study from Mulago and Jinja hospitals revealed that among 403 pregnant women with hypertensive disorders, 54.1% had severe preeclampsia and 42.7% developed eclampsia. The maternal mortality rate for preeclampsia-related conditions was 780 per 100,000 live births, more than 4 times the national average. For preeclampsia, Dr. Yarugaba added, "The major problem is high blood pressure that builds up quietly during pregnancy. Many women never know they have it until it becomes life-threatening." One of the biggest challenges is low awareness. While 95% of pregnant women attend at least one antenatal visit, only 48% complete the recommended 4 visits, and just about 42 to 58% deliver in health facilities. In the critical hours after birth, only 10 to 15% of women receive full postpartum monitoring. Yet it is within these hours that complications like PPH and seizures are most likely to occur. Pregnancy often looks normal until something goes wrong, Dr. Barugava explained. Many mothers think if they feel okay, then the baby is fine too. But things like high blood pressure or low blood count can be invisible until they explode into an emergency. Also, women rely on traditional birth attendants at clinics, so they miss early warnings. We need to change how we talk about pregnancy. It's not just about craving weird foods and waiting for the baby. It's about monitoring risks that can silently kill. Esther Charity, a midwife at a health center 3, echoed these concerns. "In my experience, I rarely encounter PPH and eclamptic mothers because our delivery numbers are very low, maybe 1 or 2 mothers per month, and most come in the second stage, but we still face serious limitations. We are not very well equipped. We refer most risk cases to higher level facilities because we lack a theater and essential drugs." The warning signs mothers should look out for include swelling in the legs, dizziness, epigastric pain, constant headaches, and confusion. Some mothers don't attend antenatal care at all. Others believe in herbs or witchcraft. Efforts by the Ministry of Health and its partners to reduce maternal mortality include training more health workers, equipping health facilities with essential medicines, and encouraging antenatal visits. Early and regular antenatal visits, routine checkups like blood pressure, urine protein, and hemoglobin can save lives when done early, Dr. Barugava advised. During childbirths, Skilled health workers must be ready to act fast, whether it's stopping bleeding or managing blood pressure. A 5-minute delay can be the difference between life and death. Even after birth, mothers need follow-up care. Some women develop high blood pressure after delivery, and they never see it coming. During the 2024 National Safe Motherhood Conference, Gift Malunga, UNFPA, Uganda country representative, reminded the nation of what's at stake. No woman should die giving birth. We can make this a reality by working together and leaving no one behind. Dr. Byarugaba concluded, starting antenatal care as early as possible. Don't wait for the belly to show. Attend all your visits, even when you feel fine. Give birth in a health facility with emergency facilities and trust your instincts. If you feel dizzy, swollen, weak, or notice something strange, don't keep quiet. Seek immediate help. Pregnancy is beautiful, but it must be watched closely. Protecting your life is part of loving your baby. Increasing community education, investing in rural health infrastructure, and making maternal health a household conversation are key steps to addressing this hidden crisis. Raising awareness about postpartum hemorrhage and preeclampsia is not just a medical issue, it is a matter of life and death for Ugandan mothers. For Science Television Network, I'm Martha Namono.